Hey everybody, this is Jessica here. This is a post, yes, this is a post update from my thyroid surgery that I had, or a thyroidectomy. If you want to know like my history and stuff, you can go and watch my pre-thyroidectomy, and it just tells you like my thyroid history and stuff. But I had my surgery August 3rd, and I've been doing okay. As far as like side effects, I really haven't had any side effects, so that's been a plus. I did get the results back from my pathology test, and it was cancer. So now what I'm gonna have to do is to do a radiation, or a radiation iodine pills. I did it before, but it was supposed to like shrink it, but it didn't. But this is gonna be like a way higher dosage. So what my doctor said is that if the cancer had been just contained to the thyroid, like surgery, take it out, that's it, boom, we're done. But it had spread to the lymph nodes, so that's why I have to do radiation to get some of the tissues and cells that maybe they couldn't get when in surgery. So I found out at my home, my hospital that I go to, you know, they send you your medical stuff over line, and I got it. I was at home by myself, and I read it, and it had me a good cry, because I knew it could be possible, but we just never knew. We've been battling this for 4 or 5 years now, trying to get this surgery. So I was sad. I cried about it and all that, but you know, take it with a grain of salt and just keep on going. That's all you can do, right? So they're gonna put me in a hospital for a couple days, and I have to be quarantined. Like, no one can even come and see me. Like, they won't let you in because of such of the high dose of radiation. But as you can see, here's my scar, or it's still healing. It still has a stair strip on it. And then right here, well, right here is where the drain was, and it still oozes a little bit, but I just put a bandage over it and it's good to go. But it's healing pretty good. Like, today is a week since my surgery, and I drove for the first time last night, and I did really good. And all that, and I've been on my thyroid medicine, so I kind of contribute that to me feeling good. Now starting today, I am gonna be off of my thyroid medicine. So my doctor said, you know, you're gonna be more slow, you're not going to be able to do as much because you're not going to have that hormone to keep you going. So that's gonna kind of suck, and it's going to be longer for me to be able to exercise and get back into a routine now, but this is just what I have to do. Now about the surgery, I think the idea of the surgery was way more scary to me than the actual surgery. My surgery took about 3 hours. Like I said, they took out the whole thyroid plus the glands. And it went good. One of the nodules was hard, so my surgeon said that it could have calcified when they did the last biopsy or something like that. But the part that was the cancer part was on the left side, which was the smaller one. So I woke up out of anesthesia and I didn't really hurt at all. Like the whole entire time I was in the hospital, I didn't even take pain meds because I really wasn't in pain. You know, just like it hurt to swallow. Like it feels like you have like strep throat. Like it just, your throat just hurts to swallow. So they brought me lunch, or was it dinner by that time? They brought me dinner by that time. And you know, they brought me like Jello popsicles, it was Jello popsicles, broth, but I don't think I had the broth. I think I just ate the Jello and like a couple licks of the popsicle, and I was done. I went back to sleep. So excuse me. So, and then like the next day, you know, I had like mashed potatoes, you know, just like soft food. And then, you know, by the time I left the hospital, I was eating solid food, you know, like I think like I had like pork chop, gravy, mashed potatoes. So, I mean, I think I did really good. Like I thought I wasn't going to be able to talk at all. So like my mom and I, we had like a whiteboard that I could write down if I needed something, but I didn't even need it, you know, because I was talking like that day. And it just hurt a little bit. It's not like an unbearable amount of pain. It's not like you're having a hip replacement or a knee replacement or something like that, you know. So if you are gonna have the surgery, just know like it sounds scary, but it's like not, the surgery part is not a big deal. Like it's easy peasy. Well, at least for me it was. So some of the things I've noticed since then, like before I used to snore really bad. I'm talking like my dad was a snorer, but I was like almost like on my dad level snoring, and it was bad. And like my mom and everybody would be like, oh, I bet you have sleep apnea, that's probably what it is. But I have not snored a day since my surgery, so that's a plus. It's actually a miracle, you know, because I mean, I wouldn't want to be on a sleep apnea machine or a BiPAP machine, you know. Some of the other side effects are I don't get as hot anymore. Now I find I'm cold all the time, and I don't know if that's just because of the surgery or because I don't have my thyroid anymore. But usually like I have my air on like 70 during the day, but now that's even too cold for me. I'm just like, man, I gotta crank this bitch up to like 70, 74, 75. I feel like an old person, but I mean, that's good, right? And I've noticed my appetite is not how it used to be. And again, I don't know if that's because of the surgery or because I just don't want to eat because my throat was hurting or what, but you know, my throat is pretty much back to normal. I just can't talk at the same level that I used to, at least not for right now. But I haven't been eating as much as what I used to, but I haven't been able to exercise to lose the weight. So, you know, but all in all, I think the surgery, well, it definitely was a good thing to do because it was cancer. So it definitely needed to be taken out of my body. So, and it's healing pretty good. I go see my surgeon next in 2 weeks. I go see my surgeon, and I guess I'll take the stairs strip off and, you know, see how my scar's healing and all that stuff. So just know that if you do have to have this surgery, it's not the end of the world. Yes, you will have a scar, but a lot of people's scar heals. And I'm the type of person to where I don't care if you stare at my scar. I'll make up some crazy off the wall reason why I have it, you know, but it's not the end of the world. You know, it's I always have this saying that, you know, they took our butterfly, but we're still butterflies. Cancer sucks. And don't let people tell you that, oh, well, if you're gonna have cancer, thyroid is the best cancer to have. It's the most treatable, like, but it's still cancer. Your body is more susceptible to cancer now. So how is that good? Yeah, it's one of the most treatable cancers, but it's still cancer. Like, that doesn't give you a pass. That doesn't make it okay. I just sometimes think people just don't think about things before they say it, you know. But that's kind of been my experience with my thyroid surgery. Now with my radiation, they are going to take me off of my thyroid hormones, and then they're not going to put me back on it until after the radiation. So I probably will be a little bit weak, a little bit tired, you know, more so until this gets underway. So I'm not scared. It's just I'm the first one in my family to have thyroid cancer, and when I was telling people, they just couldn't believe it, because you just don't want to think that it is that, you know. But I'm a tough cookie. I'll get through it. No matter what it is, I will get through it, just like you will get through it. It's gonna be okay. Everything's gonna be okay. So thank you for watching my video. If you haven't subscribed, please go ahead and subscribe down below, and don't forget to like this video, share this video with anyone you know that is having thyroid issues or thinking about having thyroid surgery or anything like that. Like, it's not all negative. There are some positive stories out there. So thank you so much for watching, and have a wonderful day. Bye.